And now it's my pleasure to call one of figure of vascular surgery in Egypt and worldwide, Prof Tarek abdelazim, to know recent trends in wound healing.
استنى بقى ادينا دقيقة زيادة كده ولا حاجة. من البوينتر. Thank you, Mr. Chairman. I was asked to give a quick review of the subject of concepts of wound healing. And it's actually a very interesting subject. And the more you read about it, the more you realize how rapidly changing and evolving these concepts are. Now, normal wound healing goes through three phases: the inflammatory phase, the proliferative phase, and the remodeling phase. This is just for simplicity, but in real life, it's a continuous, gradual process from the infliction of the wound until complete healing. The inflammatory phase lasts for about 2 weeks, and it's controlled by the mast cells, macrophages, and neutrophils. And these, in turn, produce chemokines, cytokines, and growth factors, the most important of which are the tumor necrosis factor alpha, interferon delta, and the interleukins, all of which recruit fibroblasts and epithelial cells for the subsequent phases of wound healing. Another important thing that happens in the inflammatory phase is that you have neutrophils on one side producing matrix metalloproteinases, and on the other side, the macrophages are producing tissue inhibitors of metalloproteinases. So these are the inhibitors of the metalloproteinases. And there's a very delicate balance between the two that keeps metalloproteinases from overdoing their job. Because the normal job in wound healing is to clear the damaged tissues, to remove the devitalized, the necrotic, and dead tissues from the wound, to set the ground for a nice and clean healing process. Now, if they overdo that, they inhibit the collagen synthesis, they break down the collagen that's necessary for the healing. And so you have the metalloproteinases on one side, the inhibitors on the other side, with a very delicate balance between the two to produce the normal healing process. And metalloproteinases are very highly specialized. So you have MMP1 and 8 for collagen breakdown, 2 and 9 for gelatin breakdown, and elastase for elastin breakdown. And then we move on to the second phase, the proliferative phase. Here you have macrophages producing growth factors, PDGF, TGF-beta, and the vascular endothelial growth factors, all of which produce fibroblasts, very essential for the healing process. And at the same time, the hypoxia produces the hypoxia-induced factor 1 that's very important for angiogenesis. And this is what forms granulation tissue, fibroblasts and new capillaries forming the granulation tissue, which is, of course, the base for healing. Once you have the base of healing, good granulation tissue in, then the remodeling phase starts with epithelialization from the periphery. Again, this is controlled by epithelial growth factor, keratinocytes growth factor, and the MMPs breaking down the dead tissues for the healing process. The remodeling phase also includes the maturation of collagen. Initially, you have type 3 collagen, which is immature collagen, which you see here. It's unorganized. This is the collagen that you see in reticular tissue. We want to move that to type 1 collagen, which is the mature collagen that you see up here, which you normally see in tough structures like tendons. And on this scanning microscope, you can see the difference between the two types. And again, this is dependent on the delicate balance between matrix metalloproteinases and their inhibitors. Now, in abnormal states, what happens is that you have prolongation of the inflammatory phase beyond the normal 2 weeks' time. This is because of continuous irritant, a continuous problem that excites the inflammatory process, which may be inadequate tissue perfusion, venous hypertension, infection, and so on, the things that result in abnormal wound healing. As a result of that, you have persistent function of the cytokines, increased function of the matrix metalloproteinases, and so instead of just cleaning up the dead tissues, they start breaking down the collagen, thus interfering with the healing process. Fibroblasts and keratinocytes are decreased, and angiogenesis is also depressed. Fibroblasts in abnormal wound healing states, like chronic ulcers, exhibit a very interesting phenomenon, so-called cell senescence, or getting old. And so they're slow, and they have very altered morphology and malfunctioning. And you can see on this slide down here, these are the normal, nice, proliferating fibroblasts, and these are the deformed, disorganized, malfunctioning fibroblasts. And so when we come to treat wounds, we have therapeutic targets. There are several concepts now based on the basic knowledge that we have for wound healing. One of these agents, one of the new concepts, is modulating the MMP function, inhibiting it. And a product called Promogran came out on the market to inhibit MMP and thus reducing the breakdown of collagen and enhancing healing. Unfortunately, all these drugs are very, very expensive. Another simple concept is the use of anti-inflammatory agents, doxycyclines and non-steroidal anti-inflammatories have also been shown to reduce cytokines and MMPs, thus helping with wound healing. And then the concept of using growth factors themselves to promote wound healing. And the commercially available growth factor that's been used is the platelet-derived growth factor. And they got this nice ointment, Regran-X, again, increases, like any growth factor, increasing angiogenesis, fibroblast activity, and epithelial healing. Again, the problem is, of course, the cost. This little tube is about $1,000. A very interesting new concept is the production of living human tissue equivalents. What they do is they harvest the fibroblasts and epithelial cells from the circumcised skins of the neonates and use a bovine collagen latex to actually engineer skin that's very similar to the normal skin. The only difference is it doesn't have hair follicles and it doesn't have sweat glands, but it's a normal epidermis and normal dermis, which results in producing growth factors, cytokines, and fibroblasts, everything that you need for wound healing. But again, we're talking about $1,000 to $1,500 for this little piece. It's too expensive for wide range use, but I think it's for future application. Now, wound dressings, also several concepts come into the action when we talk about wound dressings. And do you know how many wound dressings we have on the market? Actually, 5,000. 5,000 products are labeled in the market under the title of wound dressings. Huge number. But they're all based on two main concepts. Number one, moisture to allow for tissue growth and epithelial migration. And number two, removal of the exudate with the bad cytokines and MMPs that you don't want into your wound. For that, you have so many different varieties of wound care products. I will skip over them quickly for the sake of time. But the simplest is just to use wet saline gauze, put it on the wound. This will create a moist environment. And then when you remove it, it will remove the exudate that you don't want. It's simple, it's cheap, it achieves nice results. We have the films. We've all seen all these products. It's transparent. You can see the wound. It keeps the moisture, but it can damage the skin as you remove it. Hydrogel, hydrocolloids, foam, alginates, composite grafts. We all know about the different types of dressings, so I will just skip over these for time. And then came the concept of antimicrobial harboring agents like iodine, silver-based, and topical antibiotics. Unfortunately, the results have not been more superior to the bland dressings. And then a very interesting concept is now the use of hyaluronic acid in wound healing. It's a natural component of the extracellular matrix, naturally occurring, and has a very strong hygroscopic product. So it produces the moisture that you need for wound healing. And it also promotes angiogenesis and fibroblast formation in the proliferative phase, which enhances the proliferative phase of wound healing, as well as the remodeling phase. It helps with the epithelialization, moving of keratinocytes over the wound, and the reorganization of the collagen or the maturation of collagen. So it basically affects all processes of the wound healing process. And it even has an antimicrobial effect via acting on this protein called beta-defensin 2. Charcoal dressing have the advantage of removing foul odor from the ulcer.
1 minute left.
I know, thank you. And then we have the negative pressure concept, the VAC concept that we're all now using widely, which basically removes the excessive exudate and stimulates macrophages and angiogenesis. And then finally, HBO, hyperbaric oxygen. Theoretically, again, it works on all steps of wound healing, but unfortunately, the results, again, have been equivocal with its use. Last but not least is that you have to correct the underlying etiology. For any of these concepts to work, you have to correct the underlying etiology, whether it's venous insufficiency, chronic ischemia, or a diabetic foot problem. Thank you.